Today we will discuss AML, but really quickly, are you fed up with lectures using complex vocabulary to appear smarter? Whether you're a current student or healthcare provider, doctor, nurse, or pharmacist seeking to remain up to date, this channel will provide a simple way of teaching emergency medicine on demand. Here on Emergency Medicine on Demand, my goal is to help you retain tons of information in the shortest amount of time possible by explaining difficult conditions in layman's terms. AML stands for acute myeloid leukemia. This is a cancer that affects the blood and the bone marrow. It's a disease where the body produces a large number of abnormal white blood cells that don't function properly. These cells crowd out healthy blood cells, making it harder for the body to fight infections, control bleeding, and carry oxygen. Signs you might have AML: fatigue, feeling very tired and weak, frequent infections, getting sick, often due to a weakened immune system, easy bruising or bleeding, unexplained bruises or bleeding gums, weight loss, losing weight without trying, pale skin, looking paler than usual, fever or night sweats, unexplained fevers or sweating at night. If you notice these symptoms, it's important to see a doctor for proper evaluation and diagnosis. If someone has acute AML, here are simplified steps to take. See a doctor. Get a diagnosis and treatment plan from a healthcare professional. Follow treatment, such as chemotherapy, radiation, or possibly a stem cell transplant, which is pretty much a bone marrow transplant. Stay positive. Support mental health through family, friends, or counseling. Eat well. Focus on a balanced diet to help maintain your strength. Rest. Ensure plenty of rest and avoid strenuous activities. Manage symptoms. Work with doctors to address any symptoms such as pain or infections. And of course, regular checkups. Keep up with doctor appointments to monitor your health. In the hospital, here's what they do to help someone with AML. Diagnosis: blood tests and bone marrow biopsies to confirm AML. Chemo: give medicine to kill cancer cells and reduce the number of abnormal cells. Supportive care: provide blood transfusions or antibiotics to help with symptoms and infections. Stem cell transplant: replace unhealthy bone marrow with healthy stem cells from a donor. Monitor health: keep a close watch on vital signs in response to treatment. Manage side effects: help manage any side effects from treatment such as nausea or fatigue. And educate patients: teach them and their families about the disease and the care options they have. This is to treat leukemia and improve the patient's overall health and quality of life. Some commonly used medications for AML are cytarabine, daunorubicin, idarubicin, venetoclax, which is a newer medication that targets specific cell pathway in AML, azacitidine, sometimes used for patients who cannot tolerate intensive chemo, decitabine, another option for those with specific types of AML, especially older patients. These medications are typically prescribed based on an individual patient need and treatment plan. Always consult a healthcare provider for specific recommendations. People at an increased risk of developing acute myeloid leukemia include older patients. The risk increases with age, especially those over 40, older adults. Previous cancer treatment, people who've had chemotherapy or radiation for other cancers. Smokers, they have a higher chance of developing AML, exposure to chemicals such as benzene, genetic disorders such as Down syndrome, and family history. These factors don't guarantee someone will develop AML, but they make it more likely. Now you need to watch my video on rhabdomyolysis or have a look at pneumonia.